Good morning, I'm Dr. Tim Jochen, and I'm live today talking about the best of both worlds. And we call this segment Best of Both Worlds because we're talking about cosmetic and how it impacts medical and how medical impacts cosmetic. And it's very self-evident when we talk about keloids, because keloids are a medical condition. They're thick scars that extend beyond the border. Okay, now if you have one of these, it's a medical condition, but it does impact you cosmetically. And so what we're going to talk about is, first of all, let's talk about the difference. A lot of people come to me and they say, they don't want to do a procedure, or they're here to get treatment of what they call a keloid. And keloids oftentimes are confused with just brown spots on the face. So darker skinned people get really concerned about the pigment changes and they think they're keloids. Well, the reality is that's just a pigmentation change. So that's nothing to worry about. Over time, we can get that to go away. In our last segment, we talked about hyperpigmentation or discoloration of the skin. Now, a keloid is defined as a scar that extends beyond the borders of the initial trauma. Now, if we look here, that's a keloid because you can see it's big and then it extends beyond the borders. And if we go here, we can see this is a surgical scar that got raised and big. So this would actually be called a hypertrophic scar. Now, this is just semantics because if you have this, you're not going to be happy either, but we treat them both the same way. But when you're doing a cosmetic procedure, a lot of times people say, I don't want to do anything because I don't want to get a keloid. And so we have to know the difference. Now, we don't really know what causes keloids. We know that during the healing process that the scar just kind of overgrows. I call them aggressive healers. And people that are darker skinned are more likely to get keloids. And also, there are certain areas that are more prone to getting keloids. For example, the ears are more prone to getting keloids. Also, the chest area is more prone to getting keloids. And also, the arms are more prone to getting keloids. Now, I trained in New Orleans where we had a huge African-American population. In fact, most of my patients were African-American. And we did see keloids in these areas, but there are certain areas where you're unlikely to get a keloid, and that is typically on the face. So you don't have to worry if you're a keloid or about doing things on the face, typically. Now, when we have keloids, let's get back, well, we can talk about this one. There are so many different treatment options for keloids. And at Contour Dermatology, we have a huge collection of devices that aid in treating keloids. Now, the first thing that we notice when we look at this, and that's what I always want to start asking the patient when we first have our consultation, is what bothers you about this scar? Is it the color? Is it the fact it's raised? Is it, what is it about the scar? And if we look at this one, there's a couple things that bother me right away. And the first is that it's red. So if we just got rid of the redness in this scar, it would be much less noticeable to the world. And so what we found statistically, or not statistically, but in studies, is that just doing lasers can actually improve the redness and also help minimize the scar. So here at our office, we can use the XLD or the V-beam. Now, another device that's been found to help with contracted scars, keloids, is the CO2 laser. And this laser is a destructive laser. It damages the collagen. We're not sure exactly why it works, but by using the CO2, that may help. The most common treatment options that you're going to get when you go into an office, a medical office, such as a dermatology practice, are to use injectable steroids. The one that we use in our office is called Keloid. And what this does is it helps to deactivate the fibroblasts, which are the cells that are making this keloid get worse and grow. And so we can do the Keloid, and in my practice what I like to do is I like to add 5-fluorouracil. And the reason I like to add 5-fluorouracil is because it really minimizes some of the risk factors you have with steroid injections. And those risks with steroid injections include, if we inject this keloid here, or this hypertrophic scar, and the steroid gets out into the surrounding tissue, what can happen is you can get atrophy or flattening or hollowing around the scar. So it creates this bump with atrophy around it like a moat, and it makes it look worse. So with a 5-fluorouracil, we can actually minimize that by adding that ingredient. Now, we also can use calcium channel blockers, and we can also use bleomycin, and those are some of the other injectables that we use in our office. Now, the people oftentimes just want to get these lesions cut out. The problem with excising the lesion is trauma is what caused this to occur in the first place. So guess what happens if we cut it out? That's also trauma. So we have to be very careful with just simply excising one of these, because studies show that you have at least a 50% recurrence. And so a small trauma can cause these to occur, and guess what? The surgical excision is going to be actually a bigger trauma to the area, so we have a high chance of it coming back. Now, there are different ways we can do this, and that's by combining excision with radiation, which can minimize that risk, and also you can do injections with steroids or 5-fluorouracil or interferon or all these other options. That's an option as well, but I really try to discourage people from having these surgically excised. The thing that you can do topically at home to minimize keloids from forming is to start by using silicone dressings. These are available over the counter at pharmacies, and all they are is they're just silicone. We're not really sure why they work. There's some occlusive property that may help aid in minimizing this formation. So that's one thing that you can do at home. Just go to your pharmacy and say, I want a silicone gel sheet or a silicone gel to put on my scars to minimize the risk of keloiding. The other thing you can do is you can do pressure, particularly on the ears, and this is for dark skin types. If you get your ears pierced, you can get these horrible honking keloids on your ears. So if you do these pressure earrings, they help to minimize keloids as well. So if you have any questions about your scars, please contact us at contourderm.com or come and see us.